Shri Biswabhusan Harichandan, Honorable Governor of Andhra Pradesh, Chief Guest of this afternoon, distinguished dignitaries on and off the dais, ladies and gentlemen, welcome to the inaugural ceremony of the CEO Forum of AAPI GHS 2023. May I invite Dr. Ravi Kolli, President, American Association of Physicians of Indian Origin, United States of America, to kindly deliver the welcome address for the next 3 minutes. Dr. Kolli, please.
Hello, good afternoon. Honorable Governor Biswabhusan Harichandan ji, Namaskar, Pranams. We are so pleased to have you here inaugurating our CEO Forum. And I also want to welcome all the delegates from USA and local medical schools and medical colleges and professionals here. I also want to welcome all the CEO Forum panelists here who came all the way from United States as well as from all over the country here. And we are expecting a great discussion here following the address by Honorable Governor. So I won't take too much time because we're running a little bit behind the time. I want to thank all my executive committee from AAPI for being here and many members who came here from all over the country. Thank you again. And the Global Healthcare Summit has been a grand success so far. Thank you. Thanks to the local team led amazingly and very ably by Dr. Ravi Raj Garu and Dr. Radha Madam and the team. I'm really blessed to have you. And thank you again for all of you for being here. And we're looking forward to a great discussion.
Hello, everyone. Honorable Governor, respected faculty, fellow speakers, thank you for being here and giving me this opportunity. I want a special thanks to President Ravi Kolli as well as Chair Joseph Chalil, who had invited me to this program. So with that being said, my name is Dr. Juby Jacob Nara, and I come here with multiple hats. First and foremost, I am a life member of AAPI, so therefore I am a physician. Secondly, as you heard, I am the Vice President of Global Medical Affairs at Sanofi Pharmaceuticals, and that means I am also a leader there, and not just any leader, but a leader in healthcare and a woman leader. And I come here to emphasize the importance of partnership. Most folks, when they hear about pharmaceuticals, they think it's all about pushing medicines, making money, and that's about it. But that's not it. That's so far from the truth. Pharmaceuticals are very essential to the community, to partnership with physicians and partnership with patients. The first and foremost thing that unites us all is the well-being of the patient. And that is what I'm here to focus on. Furthermore, it's about generating and creating awareness, understanding unmet public health needs, partnering with physicians to support education. It's about research and development. I've had the opportunity personally to be part of developing over 35 vaccines globally.
It is an amazing thing to be here to sit at a CEO's forum in the presence of government leadership, global physicians leadership, and local leadership to say we are coming together to create a better world. We believe there is a great need. We understand there's an outstanding opportunity. And we also are extremely aware of the fact that the world is at the cusp of transformation. Technology is changing the way we look at things. Connectivity is changing the way we access information. Telemedicine is bringing care to rural India. But most importantly, the will of the world to have a better, healthier environment is at the core and the crux of the transformation that we are witnessing, and I believe we will witness over the next decade. I want to congratulate AAPI first, because year after year, meeting after meeting, the 15,000 strong AAPI come together as one to say we have achieved in another country, but we hold strong our roots and we will give back to the country of our birth. And for that, I do congratulate you, I thank you, and I would like to applaud all of you.
Dr. Robbie Corey, President, American Association of Physicians of Indian Origin, Dr. T. Ravi Raju, Chair, AAPI GHS India, Dr. Jubi Jacob Nara, Dr. Prasad Salasani, Chair, AAPI GHS USA, Dr. Sudhakar, Advisor, AAPI GHS, Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospital, and Dr. Jagdish Babu, CEO, Biofor, Indian Pharmaceuticals, faculty, delegates from USA and India, CEO of pharmaceutical and healthcare industry, ladies and gentlemen, members of the print and electronic media, I extend my warm greetings to you all. It gives me immense pleasure to participate in the inaugural program of AAPI GHS-CEO Forum here today. I am glad to know that the American Association of Physicians of Indian Origin is the largest ethnic medical association representing the interest of over 120,000 physicians of Indian origin in the United States of America. AAPI also serves as a platform for 40,000 medical students, residents and fellows, and supports research activities among the medical students, helps in conducting various competitive programs, thereby bringing out the talent among the young doctors. I am happy to know that in addition to the academic activities, AAPI founded a charitable institution, AAPI to contribute to the patient's care in India by setting up free clinics and conducting free health camps and organizing activities like cancer screening for women, HPV vaccination to the targeted population, establishing radiological diagnostic services, etc. In order to streamline the academic activities, AAPI has started organizing Global Healthcare Summit every year, which offers a unique forum for the physicians of India origin to come together and share their knowledge and expertise in their respective medical fields. By sharing best practices with their fellow physicians in India, around the world, and to learn from one another. As one of the fastest growing economies in the world, India faces challenges in the area of public health care. The economic growth experienced by the country since the past one decade has resulted in significant reduction in poverty. According to latest data, infant mortality rate in India fell from 37 per 1,000 live births in 2015 to 30 per 1,000 live births in 2019, and life expectancy at birth has increased from 63 to 69 years. Similarly, the maternal mortality rate has reduced from 8.1 in 2015 to 7.3 in 2018. In order to bring down the infant mortality rate and maternal mortality rate, the Government of India has been implementing several strategic welfare programs under the National Health Mission in all the states and union territories. Our country also has a vibrant pharmaceutical and biotechnology industry and leading corporate hospitals network. Yet, we face enormous public health challenge in terms of child malnutrition and low birth weights that often lead to premature death or lifelong health problems. Non-communicable diseases are the leading cause of death in the country, contributing to 60% of deaths. Heart disease, cancer, diabetes, and chronic pulmonary diseases contribute to 80% of all deaths due to NCDs, and there are 4 common risk factors arising from tobacco use, excessive consumption of alcohol, unhealthy diet, and lack of physical activities. The disparities between the rich and the poor and between those living in urban and the rural areas continue to exist in the society in the case of access to healthcare service. As you all are aware, equitable access to public health care is topmost priority because the purpose of public health is to cater to welfare of the weakest and most vulnerable sections of the society. In this regard, the Ayushman Bharat Yojana or National Health Protection Scheme, the Government of India's flagship equitable healthcare initiative, is a program which aims to provide a service to create a healthy, capable, and vibrant New India. It has 2 goals. One, creating a network of 150,000 health and wellness centers across the nation to deliver comprehensive primary healthcare services, and another to provide insurance cover to at least 40% of India's population, which is majorly deprived of secondary and tertiary healthcare services under the Pradhan Mantri Jan Arogya Yojana. This centrally sponsored flagship scheme aims to provide an annual health cover of up to 5 lakhs to vulnerable 10 crore families, covering 40% of the country's population. It is the world's largest health insurance assurance scheme that offers a health cover to nearly 50 crores Indians. It is fully funded by the government and provides financial protection for a wide variety of secondary and tertiary care hospitalization. The prime objective of the PM-JOY is to reduce catastrophic out-of-pocket health expenditure by improving access to quality health care for the underprivileged population. The private sector healthcare institutions and organizations like AAPI can support the efforts of the center and the state governments in health promotion and disease prevention activities and public-private partnership through corporate social responsibility initiatives. I hope the Global Healthcare Summit presently being held here in Visakhapatnam will provide a platform for planning of new initiatives and identifying ways in which poor and downtrodden people in India can have access to high quality, affordable and cost-effective world-class health services. I wish the AAPI Global Healthcare Summit all success. Thank you. Jai Hind.